This presentation is from Pulmonary, Sleep, Cardiology, and Critical Care Academy, an online CME-accredited course for advanced practitioners and physicians. My name is Peter Sloan, and I'd like to introduce our speaker, Dr. Alan Schwartz.
First, let's define what we mean by daytime hypersomnolence. It usually consists of excessive daytime sleepiness when wakefulness is otherwise expected. Fatigue and sleepiness are sometimes used interchangeably, but in fact, we need to learn how to distinguish these two symptoms one from the other. Fatigue consists of nonspecific tiredness, lack of energy, loss of stamina, a depressed mood, whereas sleepiness consists of dozing or napping inappropriately when otherwise you expect to be awake, sleep attacks, meaning you fall asleep suddenly without warning, and automatic behavior, consisting of not recognizing how you got from point A to point B, in large part because you were in a somnolent state where consciousness is impaired. And then finally, there's periods of inattention, often due to microsleeps or falling asleep for just a few seconds. Well, why is it that people fall asleep when they should otherwise be awake? Well, the reason has to do with our fundamental understanding of the factors that cause us to go to sleep in an organized way over a 24-hour cycle. And that has to do with the sleep-wake cycle, where sleepiness is promoted by the homeostatic sleep drive, which increases progressively with the amount of time that you spend awake. And the homeostatic sleep drive is often counterbalanced by the circadian wake drive. Circadian rhythms conspire to either wake us up at certain times in the 24-hour cycles, such as in the morning, and as it turns out in the early evening hours, and they also conspire to put us asleep at night, particularly as we get into the second half of the night. Circadian rhythms are also biologic rhythms that are coordinated by the brain and cause the siesta period to occur in the early to mid-afternoon hours. So these circadian rhythms interplay with the homeostatic sleep drive to cause us to have a normal sleep-wake cycle. This slide illustrates the interplay between homeostatic and circadian mechanisms that combine to make for a normal sleep-wake rhythm. As mentioned, the homeostatic drive, or sleep debt, increases progressively over the course of daylight hours and decreases after sleep onset. In contrast, the circadian rhythm is more sinusoidal, and at its nadir here, the alerting stimulus goes down. And it's during those periods of time that we really are meant to sleep a normal night of sleep. But in addition to these two factors, homeostatic and circadian drives, within the sleep period, there are ultradian rhythms, rhythms that occur more than on a 24-hour basis or more frequently than every 24 hours. And these ultradian cycles are represented by the cycles of non-REM and REM sleep. Because initially when we fall asleep, we go into non-REM sleep. And then after about an hour and a half, we have our first REM cycle. And then thereafter, we have repeated REM cycles roughly every 90 minutes during sleep. These ultradian REM cycles get longer and longer as the night goes on, usually making for anywhere between 4 and 6 REM sleep periods. The REM cycles are much more keyed in to the circadian rhythm than to the homeostatic drive to breathe. And as a result, we generally think of the second half of the night as being driven by circadian cycles that push us more and more into REM sleep, and longer bouts of REM sleep at that. In contrast, the first half of the night is predominantly non-REM sleep, and that tendency toward non-REM sleep is governed by the necessity of paying off our homeostatic sleep debt in the first half of the night. A normal night of sleep, grossly speaking, represents the combination of the first half of the night in which we pay off our sleep debt and the second half of the night in which the circadian tendencies tend to push us more and more into REM rather than non-REM sleep and help us maintain sleep for the second half of the night.
If you'd like to learn more, please visit our educational center at pulmonaryandsleepacademy.com, where we have 70 hours of self-paced online CME-accredited courses covering pulmonary, sleep, cardiology, and critical care medicine. Please enjoy more of our short visits on our PSA YouTube channel. You can purchase our full courses with an exclusive 10% discount code using YouTube10.